Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Robert Henehan, a healthcare IT leader, consultant, and AI evangelist who has lived through every major wave of change in healthcare, from paper charts to Epic, from on-premise systems to the cloud, and now to an AI-driven future. Robert began his career implementing the clinical side of Epic and then extended into business side of healthcare, working with platforms like Workday, ServiceNow, Salesforce, and Microsoft to help health systems turn strategy into measurable outcomes. At El Camino Health, he led analytics and business application teams supporting thousands of employees, drove Epic Cogito implementations that dramatically reduced manual reporting time, and helped organizations achieve top-tier recognition for analytics and data quality. Today, as a founder of Henecorp and COO of BastionGPT, he helps healthcare organizations, consulting firms, and startups make sense of AI, what's real, what's hype, and how to implement in ways that improve operations, patient care, and workforce efficiency. Robert, welcome to Health Tech Heroes.
Thank you, Fasa. Happy to be here.
You have seen healthcare evolve from paper charts to Epic and now AI. When you look back, what was the defining emotional moment that made you realize you wanted to spend your career transforming how healthcare works? What was that pivotal moment?
It's funny, I can actually look at that specific moment. I was riding in a car with one of the physician leaders from Epic to an Epic Go Live. And I was talking to him. So I studied biology and I was like, I'm thinking about medical school. Do I go to medical school? And he looked at me, he's like, why would you go to medical school? You're already telling me what to do. So I was like, oh, wow. It made me rethink the impact I was making from the technology side on healthcare. So that was just a very pivotal moment to be like, wow, okay, you can make a big impact on healthcare via electronic medical records, technology, processes that then have a exponential impact on patients and the system too. So that was that moment where I was like, you're right, which was cool.
So what would be the difference, making a difference as a clinician and as a health tech? Because I'm asking this very specific question because you jumped right into it, because the title of my podcast is Health Tech Heroes. So I know the impact of it. From your perspective, what is that important part that you are really proud of because you are in this area?
Also back in my Epic days, this was right around when meaningful use was being implemented. And so that meant that was the incentive program for healthcare to adopt EHRs. So Epic was the main platform and had a great way to show compliance with meaningful use. And then that was a way to now use these medical records to capture data and show improved outcomes for patients, whether that was with order sets, documentation to make sure that you're aligned with best practices for care, pop-ups to sort of say, hey, you might want to think about this type of treatment, or you're putting this patient at risk if you do these things. And so you could see the impact, you could actually measure it now. So because you had the data and you had a platform, you could see, wow, this is how my care is improving or how the patient outcomes are changing. So the flip side of that was like, you've now implemented a whole new technology and process for clinicians to have to interact with their patients and the medical records. So they were now spending more time documenting, working with a computer rather than working with their patients and sort of being fit into very specific workflows for things that they used to have more control over. And so that was the trade-off from implementing the EHR and having to focus on these quality measures. So that was my background, was on clinical quality measures with Epic.
Did create some headaches, probably solved some too, but we don't want to go back. We want to go forward, right? So earlier in your days, you were shoulder to shoulder with clinicians and hospital leaders. Can you share a specific story from the period that changed how you think about human side of technology change?
I think that was sort of what I was getting into with the quality measure side, where you're like, okay, we've got this great platform. I'm from the IT, the Epic side. Like, it's so cool. You can do all this and it will help you so much. And I think the doctors and some of the nurses and others were like, I don't need your help. Like, well, who are you to come in as such a young person telling me how to practice? And not only that, but like forcing me to practice this way.
Wow.
And now I'm spending more time on notes and having more pop-ups, slowing me down in my workflow. So that was one of those where it was like, okay, there's sort of a trade-off here. But then being able to go back and show with the data the impact that it was making. And that was helpful to some of these clinicians to be like, wow, okay, now I can see how much better my patients are doing or how much better I'm doing because of how these things are being measured and reported out. And then even at the next level was, wow, there's so much more data. And now there's more self-service tools. So I can actually interact with my information and get a lot more transparency there as well. So that was sort of the next step of you've put it in and now we're going to give it back to you in a way that is helpful for you too.
So you have
Exactly.
moved from analyst and project roles into leadership consulting and entrepreneurship. That's a lot of different roles and a lot of different perspectives that you have gotten in this very particular industry. So that's amazing. So what was the key turning point where you felt you're no longer just implementing system, but actually shaping strategy and outcomes? So how has it impacted you being a leader? You went through the
Yep.
boots on the ground experience. Now you are a leader. So can you connect like what was that major transition? And the second question is, does that impact you to be an effective leader going through the process?
So I think about it where I sort of had the few different key roles that are important for technology in healthcare, which was, working for a healthcare technology company, implementing their solution, and then working for a healthcare system, implementing solutions as sort of an analyst or a consultant on those teams, and then moving into management of an analytics team and the business intelligence team, knowing what their priorities were, balancing what their workflow was and their workload was with what the priorities were of leadership. And then one of the really turning point projects there where I was like, wow, I'm impacting strategy and solutions was to work with the whole executive team at a healthcare system, the healthcare system I work with, El Camino Health, and develop a whole set of new dashboards for them that they could use every day and in their executive suite and on this giant touchscreen they implemented. And now we coordinated what were all the important metrics for them to look at, validated the accuracy of the data, and then worked with not only the analysts on the reporting side, but also the teams to capture that information, and then also the project managers and clinical leaders who knew now that they're being evaluated on these and that this is now something that was always important. ED throughput was always important and turnaround times and things like that. But now they knew that there was more visibility. And so everybody could check it. So that was sort of where, okay, I've gone from building it to now strategizing around what's important to then helping roll it out in a way that was going to help everyone instead of, balancing all these priorities from different groups that wanted things to be measured in certain ways.
Yeah. So the balancing part is probably the key because
Yep.
you were boots on ground and you really have spoken to all the stakeholders for years and you can bring that balance part. Otherwise, you have to guess the balance. And the second part, my main question was, what is the key mindset that when you are implementing versus when you're leading a strategic team? What is that key mindset? What is the development that made you a leader, right? So from implementation to hey, you need to have a certain mindset for implementation. Then being a leader, you have to have a different mindset. Can you contrast those two mindsets a little bit just for me to understand?
I think the big mindset change that sort of also came into IT leadership was it's not just about implementing. It's not about implementation. It's about support, management, and ongoing. It's a part of this whole ecosystem. It's not just your tool or your process. And so now you need to figure out, where does this sit? How do I make sure that this new technology that we've implemented is not just going to immediately become out of date, or whose responsibility is it to manage it? Do I have the resources to do that? If not, who's going to help find those resources? So that's sort of now you're in management, and now it's not just, hey, look what I've done or what I'm doing, isn't this great? It's look what everybody's doing and how do we make sure that everybody stays successful? And then also, what do we say no, or hey, these are great ideas or great things, but we want to do this later. And now let's put processes around how to decide what's important and to manage what's going to be rolled out. So that's sort of the management, not only of the people, but the technology.
So let me step back a little bit in your timeline. We want to go back to your origin story. So you were sitting in that car with that physician, talking to him and saying that I want to go to medical school. And even to be at that point that you're sitting with a physician and talking about health and medical school, there had to be some other origin, some other mindset that brought you to that place. It could be in your high school, middle school, elementary school, even maybe before. What was that brought you to actually care about people and think about?
Well, my family's all doctors. So my parents are doctors. My grandfather was a doctor. My great-grandfather was a doctor. My uncle's a doctor. My grandmother was actually a doctor. So there's lots of doctors. And so that was sort of the language I heard at the dinner table, the impact I could see. And so that's sort of that was in my blood. And then also the technology side was in my blood too, because I grew up in the Bay Area. So I grew up in Palo Alto. So I saw all of this technology being implemented and seeing all the impacts. So that's those two things sort of combined after college to then put me at Epic and having these discussions.
The question is whether it's nature or nurture. Looks like it's both.
Yes, yeah.
All right. So a little bit diving into Henecorp and BastionGPT's offerings and wins and challenges. So for someone hearing about Henecorp and BastionGPT for the first time, these are two questions, obviously. How do you explain what you do and core problems you're helping healthcare organizations?
Henecorp was something I'd always wanted I wanted to have a company like that. And I wanted one to represent me, my services, and how I can help organizations implement technologies. And I saw with the value AI was bringing that it was time to go back from being in a healthcare IT management to the healthcare technology development and rollout side. And so that's where I set up the company to start working with healthcare systems and startups to evaluate and adopt and educate themselves on how to use AI technologies. And in that process, I joined a company or have been working with a company called BastionGPT for a long time now. And BastionGPT is a great solution because right when all these AI tools came out, ChatGPT and others, there's a huge risk with HIPAA where if you're putting patient information into a ChatGPT or Gemini or Claude, you've immediately violated that patient's privacy because you don't have a secure way to do that, and they're now using that information for training. So the leader I'm working with, Josh Spencer, came from a cybersecurity background, and he was looking for this because he was seeing the risk. And so he realized there wasn't a good solution. So he set up and built BastionGPT, which gives providers and systems access to the top AI models from OpenAI, Google, and Anthropic. So now providers can use and have the flexibility of interacting with those models with patient information. And the beautiful part of this, alongside the experience with Henecorp, is what are all the use cases that you can use AI for? And every day there's something I'm surprised to hear about how people in different aspects of the healthcare industry, whether that's legal, medical equipment, compensation review, HR, or then all on the clinical side, mental health, therapists, psychiatrists have been big users, how they can find value and how they can use these tools in ways that we hadn't thought of, writing reports, generating evaluations of technologies, creating custom plans for patients. So that's sort of the explosion of AI technology, but also AI applications, which you often can now do just with these models themselves. You don't necessarily need a custom application to write a report for you about students' autism or write a forensic report for a legal case. You can just do that easily within BastionGPT, and you can do that because it gives you access to these models. So it doesn't require a custom application. It just requires your creativity and understanding of prompt engineering and the right context you give it. And so that's where the education comes in. So yeah, that's where it's really giving the power. It's fun.
Absolutely. The AI, what it has done in the last 2.5, 3 years is just phenomenal. It's mind-boggling. Correct me if I'm wrong. Basically, the BastionGPT is essentially, you can say it's probably not an LLM. It uses other LLM, but it gives you a HIPAA compliant model, right? That is its value. And there is nothing else out there that can compete with BastionGPT. Is that a fair enough assessment?
Yeah, the way I would frame it is it gives you HIPAA compliant access to the top AI models. And so there's lots of other vendors that try and do that or say they do that, but they don't necessarily show you that you are picking the top model, just sort of like you can in ChatGPT or Gemini. You can say, hey, I want a thinking model or I want the pro model. You can do that within Bastion and say, hey, I want to use ChatGPT 5.2. I want to use Gemini. And so that's all now within a HIPAA compliant framework and gives people that power and that context.
Okay, you don't want to use the flash models here, definitely in the healthcare system. So the second question that brings me, and with the understanding that this is not a challenge, but information seeking, is that with the Henecorp, what is that exclusive thing that you do that nobody else can offer currently in the industry? Like, what is that USP that we have?
Well, that's where I feel like the background that I have from clinical perspective, having, coming from the family dinner table of what's important to doctors, the technology perspective of here's how enterprise technologies are implemented and managed. And then from the healthcare system side, being an IT leader, to know what does it take to implement a technology and safely with ongoing support and management. And then onto the side of now the startups rolling these things out, because I find usually there's some gap in where people are coming from, or they don't have that full perspective from the front line to the back office to the developers that are trying to have solutions for any of those groups. So that's where it's fun to be able to have a conversation with each set of people and speak their language.
So you have led initiatives like Epic Cogito or Workday strategy and ServiceNow deployments that reduce manual work and improve services. Can you walk us through one or two concrete examples where analytics and AI meaningfully changed the outcome of the health system?
So I think Cogito is a good example from Epic, where it started with here's all this large data sets. Now let's give really simple or relatively simple, easy to use tools for people to look at and analyze that data. And not only from a developer side, but also from a clinician can get in there and play with and see their data. And now that's happening also with Workday and ServiceNow and all these other cloud vendors. You can, as a end user, see and interact with the information that's valuable to you. And that's sort of what was really what drove me as I was managing these applications, managing Workday, managing ServiceNow, was how can we now, people are putting in a lot of their time and energy to put data into these things. How can we feed them the information that's valuable to them too now? And in a way, I think that's now applying to AI, where these models are trained on massive amounts of data. But now also you can get more and more information relevant to you, the more you put in there and the more personalized it becomes to your experience. That's sort of the with those big vendors.
Coming back to the whole circle, right? I mean, like going back to your conversation of bringing value back to the doctors, like how do you do it? And this really, I think, brings it back. And specifically talking about dinner conversations from BastionGPT positions. You have taken a lot from your dinner conversations and bring it to your experience to BastionGPT. What is that story from BastionGPT that you take back to the dinner table and say that, hey, you know what, I helped BastionGPT set this up, and this was this specific area where it's just phenomenal. I mean, like it works like magic. There is nothing else out there that can do as well as this, and just absolutely necessary. What is that story that he shared?
I think that's a fun one, where it's like I could go and talk to my dad, who always gave me a hard time about sort of being on the dark side of healthcare. So I was on the IT team that was putting in the technology, and then I got a master's in healthcare administration. So I'm representing the business side. But now I could go back and say, hey, look how helpful it is to have an AI tool that can help you write your notes. And think about all that time you sat after dinner writing your notes. Now this will pretty much write it for you and capture things that you didn't even realize. So that AI scribe functionality that exists within Bastion is the thing that sort of blew everybody's mind, and now is just taken for granted. So now how can you use that to even go further and help them make decisions or see things they weren't seeing before? Or the other wonderful thing about Bastion is, like, not only do you create a note for yourself, you can create customized education for your patient pretty much all at once. So a lot of people are saying, okay, this is my patient visit. And now with their chart, with the notes, you can say, here's the information that's important to you. Here's how you can focus on, my father's in sports medicine. Here's some exercises that can help with your treatment plan. And here's where you should be careful or focused. And that's going to have a bigger impact for people when they see things relevant to them or more specific to their care. So yeah, so not only is it writing your notes for you, it's giving you a whole new way to communicate with your patients that you didn't have time to do before.
Because there are like a lot of nuanced things that can be tricky when we capture so much data. First of all is like doctors are like trained to look at data and say that they might see other anomalies, but they know that it's okay. This is the major anomaly. This is what we need to focus first and go for it. And they have, it's when you're highly trained, you also know what to ignore. So now everything is getting captured, and the fact that you're capturing it and perhaps not talking about it because the doctors also will ignore it. How do you balance that, saying that, okay, we don't need to bring it out to the doctor because they wouldn't be interested in it anyway. But if you bring all the data to doctors, then so how do you balance that? Like, where is that line you can?
I think that's where the line is moving every day. Like a year or two ago, you would say, hey, give me some advice on this patient. And it would say, hey, this one value is out of the expected range. You need to worry about this diagnosis. And they'd be like, no, that doesn't really matter for somebody that's in that weight range or that ethnic background. What's really important is this other thing. And so the human in the loop is always the key, and knowing which data to surface, because that was the other thing when I was an IT leader. We were very careful and considerate about what type of information we were going to let summarize chart information and put that out in front of the provider. Because a couple years ago, there wasn't a good way to know that it was smart enough to pull out the more important information or to not hide something. And because of the amount, that could be very difficult. So that's getting much better. And that's where you're still going to need to develop trust and validate. So that's the other important thing with all of this is you need to validate the data and the workflows and what's coming out of the tools. You can't just take it for granted. And so that's also where within healthcare systems, it's easier to implement an AI that helps in the back office setting with like revenue cycle, like claims processing, that doesn't have an impact upfront on clinical care. So that's also a piece where now if you're developing a solution that has an impact on how a doctor is going to care with a patient, you need to be much more careful and considerate about what you're doing and what it's surfacing. And that's also why with Bastion, it's really powerful, but there's still a lot of responsibilities. It's like they say, with great power comes great responsibility. And so that's why even with all the AI tools, it says, hey, these things can make mistakes. So you need to make sure that you're taking responsibility for what's coming out of it. Those are the trade-offs, but that it's getting better every day, but you still need to develop that trust. And I think that's also why people talk about how jobs are going to get replaced and things like that because of AI. And one of the people I recently spoke to said, if doctors are replaced, that means everybody else has been replaced because they're required to validate and sign off on everything that is coming out of the AI. If everybody else, they're at the point where their decision-making is being replaced, then most other people's decision-making has already been replaced.
At the last line that we're going to cross.
That's what I tell the doctors, and that makes them feel better. I don't know whether or not it's true. We'll see. But
I've spoken to people who said like primary physicians will be at risk initially. I mean, and from an insurance perspective too, and there is going to be a huge force from there, right? Well, again, and it could be a big thing eventually.
Well, I think it's going to take a while because we're still super short on family practice physicians.
Yeah, exactly.
I think the other statistic I saw recently was like they have to do 27 hours of work in 8 hours. So that's like 27. So that's where these tools will make it much more reasonable, give them more time with their patients and able to focus in the areas that are working at the top level of their skill set instead of dealing with just a person who should be taking aspirin or a leave. Now they can help the people that really need that or need the education because you still will. We'll see how long you want to talk to another human, but
hopefully more than 7 minutes or 5 or 7 minutes that we do now. When you're advising executives and team on AI adoption and governance, what are the biggest misconceptions or source of resistance you run into? How do you help them move past these blockers? I think it's a critical question for like all of us, right? Sometimes the push or the resistance comes from unexpected areas. Sometimes it's expected, but sometimes just unexpected. What has been your experience?
I see there's like two completely opposite ends that you are sort of evaluating. One is like the fear of AI and like the understanding that it brings a lot of risk, hallucinations, bias, and it's not something I can trust, or it's going to add or replace me in my job. So you're really helping advise on that fear side and say, this is where you fit in. This is how we make sure that this process is safe, that this data has been validated, that the solutions you're implementing are the best for you and your organization. And then you have a process to manage and govern this going forward. So that's sort of helping to address that fear side. And then on the other side is the over excitement or the belief that it can do all these things that it can't. And you really need to make sure that you're finding the middle way between those two perspectives, because you can overpromise and put yourself at risk, come in with unreasonable expectations of what these tools can or should do. So those are sort of the two sides that you're trying to find the middle for.
Kelly, I think you're having the same conversation with both of them. You're saying that, hey, this tool can do this and you have to do this. And so both of you are going to be employed here. It's the exact same conversation, but you're pulling people together.
Exactly.
Yeah, that's awesome. Okay. No, I did not actually split that. I thought, and I see how it could be like the push is not a spectrum, but it comes from the edges of both sides. And just going into, based on your experience, I think to become a leader, you have paid your dues, implementation side, and become a leader. I'd love to have your advice for new entrepreneurs and leaders. Looking a few years ahead, when AI analytics and enterprises are working smoothly together, what does a realistic day in the life look like for a clinician or operations leader in health system that's really gotten this right? Like it may not be even a few years, it could be a few months.
Yeah, I think the biggest change that's coming, or that I see going to be really exciting, is the personalized side of things, where it's personalized medicine. There's all the data I have for my Apple Watch that's now going to be combined with all the data in my medical record, which is now going to make it easier for a provider to understand the full perspective of my care. And as a patient too, I'll be able to have more time or more easily interact with my doctor and share a bigger story, because, as a patient, I only have 15 minutes with my neurologist to say all these really important things that have happened. But now I can bring my data, my information, summarize it, and show it and compare it to his perspective of that data. And so now we have both a stronger understanding of what is going on for me, and I can have a more elevated conversation with him. And he has an easier way of following my care and making sure that I'm staying healthy or adherent to my treatment protocols too. So that, I think, is going to help people become healthier and more focused on their care. So right now you can write those personalized discharge instructions from any of these tools. Well, now you'll be able to write those and follow and make sure that they're following through. So I think that's sort of the patient and provider side. And I think that's either already here or will be here in a year. And then I think from the operations side, I was just having a discussion about this. For a startup, it can be interesting because all of these tools that are giving organizations the ability to do coding themselves, these bigger organizations are going to be able to, with a solid team, develop and implement their own products and models that fit exactly their system. So they may not need to buy a different product to add that to their inventory, or the vendor they're working with will provide one. But I think that's where the vibe coding idea will now apply to all aspects of a healthcare system. So people will be able to vibe code their own, executive dashboards from their data and figure out what's really important to me as a COO versus you as a chief medical officer. And I don't need anybody to write that report for me. I can just talk to it. Or I can develop sentiment analysis for our phone calls, and I don't need to buy a $20,000 solution. I can do that much more efficiently within my team. So that's where I think you're going to have to be very strategic as an entrepreneur about what problem you want to solve and or who your target market is. Because the flip side too is like smaller, medium organizations that don't have those same resources are going to be much more open to having somebody come help them out at a reasonable price and with safety and security as a part of that, and then easily managed from an IT perspective. So that's where the power of coding and personalization of these products to organizations can empower all sides.
So for who want to follow into leadership consulting AI, what practical advice would you give them about building the right skills, earning trust in healthcare, and staying resilient through the ups and downs? I think it's a very critical question. You have faced it all.
I think for my path, I wasn't planned. It sounds really planned. Like I, wanted to do these things, and it created this whole full picture of what's happening in healthcare technology. But I really just was open to a new job in the healthcare technology space. Oh, okay, I found this company, Epic. I didn't really understand how important Epic was at that time, and it was still growing. And then I really was like, oh, it's following an interest path from there of okay, how can I improve quality outcomes with this EHR technology? And just sort of asking, why is this important to me? And that's sort of directing the path from there, but being open to whatever that answer came, and then having good people to help advise along the way. And then it's very cliche, but the mistakes you make are the ones that help direct you as well. And then also being open to saying, this has been a great experience and it's time for me to now get a new one that's going to add to my repertoire of experiences. And so being able to take that leap into the unknown is also, you don't know what the new opportunity is, and whatever it is going to add to your skill set too. Because I think with some of these things I was doing, I was like, I don't know how this is going to help me grow, but this is something I need right now. And as it built, it's created this full picture that has really helped me create this narrative that sounds great, but really was just me fumbling around and finding my way.
So effectively, I am just thinking about one more question, if you don't mind, just going back to like one critical part of it. So when you're a leader, you're thinking about clinicians, you're thinking about patients, definitely in health tech, but how do you bring in how the payers are going to react to this technology, right? How is there a mindset change when it's like away from implementation, right? All those are sorted out, but as a leader, you have to think about so is there a key consideration when you bring technology to the market?
Yeah, you hit on it, where there's three completely diverse sets of interests in our healthcare system. There's the payer, the provider, and the patient. And you need to figure out how you're going to either have one of them pay for your solution, and then that's what's going to create the value for you, or find some niche that brings value to all of them, which I think AI scribes really did that, where you're getting more documentation for providers more easily. Patients are getting their information, they can spend more time with their doctor, and then payers are getting more information to be able to evaluate and code effectively. And so working with payers, that's where I think you need to be open to the ideas of how healthcare makes money. I think that it's very easy to talk about how it helps people and helps patients and stuff like that, but this is the US. You need to talk about how you're going to make money too. And so whether that's saving money from improving the way care is delivered, or finding new solutions that will help payers with their own processes that finds efficiencies, that's where the money side of healthcare comes in. And that can be a little bit of if you're in healthcare to help people, that can seem a little weird. That's like, no, I'm in healthcare to also make money. So how do I help make money for the payers? And I think the other thing with payers is the idea of trying to help people stay healthy is actually valuable from the payer side. And then like you don't want to be paying for somebody to be getting treatment they don't need. So that's where you want to keep them healthy. And that's where you have like value-based payments and incentive payments to stay within certain levels of compliance. So I think it's that is one of those ways where you have to find the incentives for each group and see either who's going to pay for your solution or how do they all align in some way. And yeah, and you still got to make money, or somebody's got to pay.
Thank you very much for sharing that. It's a complicated problem. I fully understand, right? If clinicians start paying for technology and making the system so efficient, payer says that you can probably see 3 patients and stuff, 2 patients at the same time, and we will pay only for the time, even though you're seeing more patients, but the efficiency came through the technology I paid for. Why are you benefiting using that technology, right?
Yeah, it's like the battle of the AIs, your coding versus my coding.
Exactly. Yeah. So before we wrap up, Robert, you have 90 seconds. You can take more if you want to share anything we missed or reiterate anything that you deem very important. Essentially the question is yours, the answer is yours, the stage is yours.
Yeah. So I think what I really reflect on is throughout my life, I've now gotten to this point where it's like, how is healthcare technology just helping me live a better life and helping others live a better life, and creating more time or more focus on the things that are important and that are giving people the chance to spend their limited time we have in this space in ways that are even more meaningful to all of us. So that's one of those things that I have to keep at, that I come back and remind myself every day, and that really is where I think and I hope this technology is going to continue to take us, and that we then are able to use that time and that perspective in a way that's healthy and developing wisdom, because I think it's very easy to get distracted, especially with all these new inputs and ways of using AI to make decisions for you. You can now actually take the tools and the time to help yourself grow. and we can help each other with this technology too, from the organization side, the patient side, the provider side, but also help ourselves wherever we sit within that ecosystem.
Thank you very much, Robert, for your time today, and I truly appreciate it.
Thank you. Thanks, Vasa.